in their health. We're all here today, including myself, to learn as much as I can about my health so that we can, take care of our family, kind of prevent future things from happening, hopefully not allow problems to continue to get worse and more expensive. So as we are waiting for others to come in, be thinking about your own problems that you want to solve. Dr. Din here has a very innovative and different approach to medicine through the functional medicine route, has a different lens in which we try to look at the root causes of medicine. So each of you that are sitting here, think about your own puzzles that you are trying to solve for yourself, or any problems and puzzles that your family members or friends are going through. Go ahead and put these things and questions up in the chat. We won't answer them right away. We'll answer them all at the end. But leaky gut is a topic that a lot of us potentially are exposed to, as there's a lot of food processing companies out there now that kind of attack our gut. And so if you're experiencing a number of things like low energy, mood, things of that nature, and Dr. Din will go into this later, those are the kind of questions that we can help answer for you. I know for myself, I have experienced and, have bouts of issues with leaky gut. And so I have the luxury of being around my lovely wife, Dr. Din, all the time, and I can pick her brain about these things. And so I'm also investing into my education by marrying her. So thankfully, she's taking care of me on that front. But yeah, I've experienced leaky gut, and that affects me in a number of ways. That affects me in terms of my mood, my ability to control myself. Sometimes a lot of things that I want to do during the day or in life in terms of aspirations. And sometimes when I sit down, I can't get myself to do those things that I want to do. What I realize is that I have a neurotransmitter deficiency as a result of leaky gut and other things that are attacking me as well. So I'm happy to introduce Dr. Din today. She applies the functional medicine model to her practice, and really takes a look at the gut through a lot of modern testing, a lot of different approaches. So again, if you guys have any questions, just go ahead and put it up in the chat. I see we have a number of people that have been here in the past, some patients as well. Without further ado, let us begin. Dr. Din, please take us away.
Yeah, there's a couple of people in the group that I haven't, or there's a person in the group that I haven't met yet, Brenda. So welcome. Yeah, so I'm Faustine Din. As Peter mentioned, I've been practicing functional medicine for a number of years now. And my background in functional medicine started very early on in my primary care internal medicine career. So I have a background in internal medicine and was practicing primary care for about 4 years. And a couple of years into it, I just really found that I wanted to give my patients better health outcomes and to be able to prevent a lot of diseases from happening. And with the current traditional healthcare model that I was trained in and practiced in, it just felt like the tools in order to evaluate patients, looking at the root cause of why diseases were happening, and the medications or recommendations that we had to offer for patients were just so limited in getting their symptoms better. And this happened time and time again. Patients would have one chronic medical disease and then soon have another one added, and what was going on here. And what I saw as a common theme was there was a lot of, as a foundation, GI dysfunction, a lot of IBS sort of symptoms, irregular bowel movements, that sort of thing. And so I found functional medicine and started applying it to folks, and they started to get better. Within our family, we also had some health challenges that really could have only been helped by a functional medicine approach. And so I just want to create, Peter and I just both wanted to create a community, especially after we started our practice this year, in order to reach out to, our loved ones, friends and family, and those that are battling with these very tough complicated medical syndromes that are limited in their treatment approaches. So I'm so glad you guys are here for us to learn more about this. And today's topic is on leaky gut, which is an extension of last 2 weeks ago webinar when we talked about mood and energy. And so that talk was more about the microbiome, but this one is more of talking about the integrity, the health of the intestinal lining. So I hope you guys enjoy and learn a lot from this talk here. So just a disclaimer that this is for educational purposes. Use what you like, and then anything that you don't like, do your own research, try other things. And whenever patients, whenever you guys want to implement new strategies or new, medications or supplements, please just make sure that you are running it by your medical home and your doctor as well. So this slide just really depicts how there is an intimate relationship between the gut and different body systems. And when we talk about the gut, I just want everyone to keep in their mind that when we talk about the gut, there's the intestinal lining and then there's the microbiome. And the intestinal lining is basically the health of your intestinal tissue. And the microbiome is the bacterial, viral, fungal ecosystem. We have trillions and trillions of these bugs that live within us. And we have more of that density, even more than our own DNA cells. And so, there's a really intimate relationship between our microbes and us, and they really impact what diseases we can get, how we feel, and how we look, all of that. And so when you look here, even diseases like heart disease, diabetes, these, even though most people think, well, if I have a heart problem, it's only limited to the heart, or diabetes is only limited to sugar, right? It really is so much more than that. And when we trace these chronic, difficult to control diseases further back, we find that the reason for a lot of these dysfunctions start in the gut, because the gut houses 70% of our immune system. And really, the gut is the ability to integrate the outside environment into our own cells, right? And so the GI tract, it starts from the mouth to the tail, right? And when we're introducing pounds and pounds of food in throughout the day, or we're drinking, water from the environment or breathing air in, all of that is, supposed to be separate from our own body. And to integrate both is a very complex, synchronous process. And when there's issues going on, then these dysfunctions can happen. And so today I'm going to be focusing on some of the gut-brain axis, and then also to talk about some autoimmune diseases, which I'll touch on the autoimmune disease psoriasis, because there really is a gut-skin axis. And that's something that a lot of times in traditional medicine, people don't talk about. They look at skin issues as a separate issue, but it's really, rooted in the GI tract. All right. And so what is leaky gut, right? So we talk about, there's this term thrown around, it's a lot on social media nowadays, but leaky gut really is the integrity of the intestinal membrane of the gut is compromised. And so it's, if you imagine your GI tract as a tube that starts from mouth to tail, it stores all of these food particles, these bacterial, viral particles, and it is only separated from our own body, our own immune system, by a 1 cell thick layer, and that is the intestinal barrier. When this intestinal barrier, it's supposed to look healthy and have what we call tight junctions, where they're really stacked up really nicely, tightly next to each other. But when there's a compromise of the intestinal barrier, then diseases start to happen, because all of this sewage and sludge and food particles and bacteria, they start to seep through the intestinal mucosa, which is not very thick. and it starts to trigger the immune system. And when the immune system is triggered and these bacteria and stuff get in, inflammation happens. And that is when we start to see all sorts of problems. So this is what leaky gut is. And the more formal medical term for it is intestinal integrity issues, okay? And so when we talk about what are the triggers of leaky gut, it can be anything from toxins, food particles, like toxins like lead or mercury, food particles like gluten, sugar, drugs like antibiotics, infections like Lyme disease or tick-borne illnesses, or just having gut infections in itself. If you have just a lot of overgrowth of bacteria, that can cause gut inflammation. And we can't underestimate the impact of stress. The chronic stress really can compromise the immune system and make your gut more leaky as well. So again, it triggers the immune system. There's systemic inflammation. And today I'm going to be focusing on 3 general themes of inflammation. And that is, these syndromes that can happen for patients, which is pain and inflammation. So what I'm talking about is joint pain, muscle pain, autoimmune disease, and mood and energy disorders. So the very first common thing that we see with leaky gut and inflammation is that, I see this all the time in my clinic where patients say that they feel just inflamed. They feel like their joints hurt a lot, their muscles ache a lot. And a lot of times they may have, very minor gut issues. They kind of tolerate it and they feel like it's not much of an issue, but there's like this inflammation present. I even see people who have high blood pressure with this kind of chronic achiness in their joints. And when we look at the foundations of their health, which in my clinic, I check a GI test on every person, we find that there's a lot of times, intestinal permeability issues and leaky gut. And so these people feel achy. They also have a lot of inflammation, right? So your body wants to clear out this inflammation. And what ends up happening is they try to activate the lymphatic system. That is the system that moves lymph through your body to try to move your immune cells and white blood cells around. They start to have puffiness or they feel very swollen. And so a lot of times these patients also have weight gain and find it difficult to lose weight too. So, definitely with leaky gut, it can really start to make someone feel very painful and inflamed all the time. So if you know someone who has, chronic arthritis, that really is just being offered, NSAIDs or anti-inflammatories, or, they have arthritis and their workup, like for instance, their doctor checks them for rheumatoid arthritis or look at an x-ray and the x-ray's fine, the blood work's fine. Think about the gut because again, it's such a complex process, in order to assimilate the outside environment into us that sometimes things can go into disarray, especially with the environment that we live in. This is an article that directly measured zonulin, which is a marker of leaky gut. It's a very specific marker of leaky gut. Basically, if zonulin goes up, then we know that there's leaky gut present, right? They did a study where they tracked, to see if leaky gut was high, and tried to associate that with inflammatory markers that in conventional medicine, we know that if you have these markers, you are really inflamed, right? So sometimes a doctor might get a C-reactive protein or people who have really high BMIs, right? A BMI of like 35 or 40 or above. Those patients are known in medicine to be very inflamed. They tracked zonulin levels and saw a huge association between these inflammatory markers and the presence of zonulin. But think about how many times, is your doctor checking your gut health? Are they looking at the integrity of the GI system? And, is the gut leaky and how is that being addressed? many times a lot of the medications that are offered for patients with this inflammatory picture, right? Someone that might have, who knows, fibromyalgia or something, they may be offered drugs that actually even further harm the GI tract, which, is just really not getting to the root of things and just making things worse. And then when we talk about inflammation too, everyone's presentation of inflammation can be different, right? One person might have inflammation that's just limited in their joints, or another person, high blood pressure. That is, why is your blood pressure high? We talk about a diagnosis called essential hypertension. That really just means we don't know why your blood pressure is high. Here, take this medication to lower it. But that might be their only symptom, and you can have some gut dysbiosis and leaky gut as a cause for that, and that is not being looked at. And that's just where I really feel passionate about this need to look at things further and to look at what are the foundations of health. Start there. Once you start correcting things, a lot of times things get better on their own. So, I also want to talk about, another type of picture of an inflammation for a patient. And that might be, your only symptom is fatigue and maybe a little bit of depression, or you're just not as motivated to do things. That can be another sign of leaky gut. And there is, an article, well, actually, before I move on to the article, when we talk about leaky gut, right, we talked about how the intestinal barrier is leaky, allowing these bacterial substances to seep through. There is a class of bacteria called gram-negative bacteria that includes pathogens like Clostridia or E. coli, so many others, but they have on their cell wall something called a lipopolysaccharide, which, LPS is a short name for it. When these LPSs enter the immune system, right, into our own bodies, they start to trigger all these inflammatory cytokines, and they start to make people feel, inflamed. This has been proven in a study that, and this study was like over 10 years ago. I mean, we've known about these things, but it's just not being practiced and applied. But they did a study where they infused some healthy volunteers with very small doses of lipopolysaccharide into healthy volunteers, right? So people were healthy, no, significant, mood issues or no health problems. And what they did was over time at, 1 hour, 3 hours, 6 hours, they tracked inflammatory chemicals. And they saw that even with this small dose of infusion of LPS, these inflammatory cytokines started to increase. And they also tracked subjective symptoms too. They asked, are you feeling anxious? Do you have depressed mood? Are you having memory issues, working memory issues during the experiment? And they saw that there was a direct correlation with the higher, the longer time of LPS administration, and the higher that there was an association with decreased mood and increased anxiety. So, we see this a lot in my patients where, some patients will tell me that they can be feeling fine, but they know that within minutes of eating a food, they start to feel depressed or they start to feel foggy headed. And, this can happen within minutes, that the immune system starts to turn on this food particle that's coming in, or these bacteria that are seeping through, because something that we commonly see is patients may be, having issues with gluten, which is found in carbohydrates and bread and wheat and that sort of thing. That we know disrupts that intestinal barrier. So allows things to seep through, bacteria to seep through, the gluten itself is coming through. And that can happen within minutes of feeling foggy and depressed and that sort of thing. And so if this study showed that just a small amount of LPS infusion caused all those problems, when we talk about leaky gut, this is happening on, a much more severe level, and the insult that's happening in the body is much more severe. And then, when we talk about other things that can be going on to contribute to this feeling of inflammation, is when we have leaky gut, there is a process that happens where your body takes its own building blocks to make you feel good, like serotonin, is that feel good, not anxious, not depressed hormone. It takes its own building blocks, which is tryptophan, and it shunts it down and steals it into this more inflammatory pathway in order to combat what's going on. It's like all the troops are being mobilized. Hey, there's so much inflammation going on. I'm not going to worry about making all these feel good hormones and making this person feel good or sleep good, right? Because this serotonin product is also responsible for making us feel well and sleep well. But I'm just going to try to worry about cleaning up all this inflammation. So all these chemicals are secreted, quinolinic acid. We can actually measure these things on an organic acids test. It's a urine test, and see, how elevated things are. And we find that a lot of times if there's a leaky gut present, these markers are elevated. And when we start to treat the gut and to restructure that intestinal barrier, things start to get better. So it's not uncommon that we see people who are inflamed, maybe bloated, maybe have some minor GI issues, but they're inflamed, they're foggy brained, they're depressed, they're anxious, and they can't sleep, and their whole body hurts. That's just kind of a miserable way to live. But when you look at why things are happening, if you just go back to the gut or go back to the foundations of functional medicine and health, people start to get better. And no antidepressant medication like an SSRI will touch any of this sort of inflammation and gut dysbiosis and that sort of thing. So the next thing the next clinical syndrome that I wanted to talk about was autoimmune disease. And so if you don't know what autoimmune disease is, it's kind of, one of these unfortunate consequences of a chronically inflamed or a really, severe insult to the body. Because sometimes, these things may not be chronic. It might be like, I was fine, and then like one day I got bit by a tick or something like that. And ever since then, I just haven't felt well. Like that thing can happen. And the acuteness of how well, someone or how unwell someone starts to feel can be really quick. But most of the time it's a chronic thing. But autoimmune disease is where your immune system is confused, and it doesn't know the difference between self and non-self. And so if you can imagine that immune system being all ramped up, right, with all the images that we saw earlier, confusion can happen, and the immune system just is always on an on mode and it starts to attack different organs in the body. And these are the different organs it can start to attack. And sure, these medical diseases have names. We need to know what it's called. But just like, this kind of stresses the importance of looking at it from a comprehensive view. Knowing the name of the disease doesn't tell you anything about why it's happening. And the unfortunate thing and the problem that we see so much is that most of the time, once a patient has, for instance, Hashimoto's disease, they are only matched to a drug that is FDA approved or, going to really get symptoms better quickly with a drug, to either suppress the problem or to just give you the end product that you need, but it doesn't go back and trace the origins of why it happened. In functional medicine and in my practice, we ask the question, why is it happening? And a lot of times it is due to the gut. And so the other issue I have is, so we're not asking the question why. The second issue is the treatment options are sometimes just really, can be really dangerous or really just too powerful for that person's body, right? For Hashimoto's, it's not as serious, the treatment options that are offered in mainstream medicine, you just give a thyroid medicine. But things like psoriasis or Crohn's disease. In psoriasis, if a psoriasis, which is a skin issue, is a scaly kind of plaque-like skin issue that really is rooted sometimes by the immune system and the gut, those medications, what they do is they work to shut off the immune system. Things like Enbrel, Humira, chronic steroids. Conventional medicine recognizes there's an issue with the immune system, but instead of looking at why is the immune system getting confused, why is it always being triggered, they go further downstream and they shut it off. That is a problem. Why? Because when you shut off the immune system, things like cancer happen and tuberculosis happens, infections happen. And that's why all these commercials always have that huge disclaimer of these potential side effects. And so it doesn't give patients the results long-term. With my experience, those strong medications don't treat it long-term. There's so many side effects to it. And there's a scary statistic that 25% of people who have autoimmune disease will go on to develop a second autoimmune disease. So a quarter of patients are going to have another disease come up. And then after that, probably another. So that tells you that something is wrong with the foundations. It's not because by luck you have Crohn's disease or by luck you have MS, right? So let's really try to get down to the root of things so that we can, get you the quality of life that you're meant to live, and then, to try to avoid all these potential dangers of some of these medications. And sometimes we have to use medications because the damage is just so severe. People's in Crohn's disease, if you don't treat it quickly, it can turn into colon cancer. With Crohn's disease patients, they're recommended to get a colonoscopy every couple of years because of that high risk of having colon cancer. So in that case, these strong medications play a role. I'm not saying don't use prescription medications. They are life-saving, but we're not only trying to extend life, right? We're not only trying to save lives. We're trying to have quality of life. And, I really feel like that's where functional medicine can come in and be able to contribute to that and to have that more of a completeness picture. This is a graph from the New England Journal of Medicine, just showing how, the rates of these acute infectious diseases over the last 80, 100 years has dramatically improved, right? We don't have to worry about this really anymore. But over the last 80 years, these autoimmune diseases has just increased, it's staggering to see how much it's gone up. So type 1 diabetes, MS, Crohn's disease, asthma, an inflammatory condition of the lungs. And so I just want to, stress the importance that the gut is possibly playing the role, because it's not like over the last 80 years, our genome and our genetics has just mutated, right? And now we're getting all these things. There's probably many reasons to it, but most of it revolves around our environment changing, the air we're breathing, the food that we're consuming, the different fertilizers, chemicals, and, the stress that we're dealt with, nowadays. All of that is changing, but what is the most powerful way of taking the environment and putting it into our bodies? It is through the gut, and it's through eating. So, we need to look at that to really evaluate this in completeness. So, the literature just has it over and over and over again. This was a recent article that shows that a disrupted intestinal barrier, right, leaky gut, directly just demonstrates that there's a high association with the more leaky gut there is, the more inflammation there is in psoriasis. And, a lot of times, this is not being looked at. So always start with the gut, I always say. I wanted to share an actual lab report that we get in our clinic. So this is the GI map test. This is the first test that I get on almost all of my patients. And so what it's looking at is the presence of these bacteria, which we are expected to have some level of all of these, right? It's a garden, it's an ecosystem. So, all of these bacteria play a role. You can't have only good guys there. You need to have a balance. So there's a kind of like a breakdown and a buildup process. There's some inflammation, but then there's not too much. And a lot of these bacteria can produce healthy things for us and good things for us. The problem is when it gets high, and when there's a lot of gram-negative bacteria, like for instance, these are mostly gram-negative, they really trigger the immune system. So this is what I would call a dysbiotic picture, dysbiosis. Same thing with the yeast that's present. Some is fine, some is normal, but when it's high, it's a problem. When we see this, this is where we look at the leaky gut markers, right? Zonulin, like I talked about, that is a direct leaky gut marker. That is high. And then this IgA level, that is immunoglobulins, that is your immune system that's specific to the gut, that is high. It's showing you that there's a lot of inflammation here. And this person, you know, typically can be a person that's feeling tired. They may have depression. Their bowel movements may not be optimal. You know, maybe they have a couple of days of constipation, and then after 4 or 5 days, then they start to have a looser, more diarrhea-like bowel movement, and they think that that is, you know, it's just me, right? But it's like, well, look at this gut profile, and you know, when we start treating things, their GI habits start to change too. And so, you know, so many different clinical pictures and clinical patients that I see can have a profile like this, but their presentations are just all so different. But when we treat this, it's kind of like moving a boat, right? It's not going to happen overnight, but when we start healing the gut and, you know, getting this dysbiosis and this integrity better, the boat starts to shift, and people start to feel better, and they start to rely less on their medications. They have less medical disease occurrence. And so how do we do this? So in my practice, I use the 5R method. That is the functional medicine 5R method to treat gut dysfunctions. So it's 5 R's. It's remove, replace, reinoculate, restore, and rebalance. So remove is remove the triggers. You know, look for toxins if you know, appropriate. Remove triggers that are known to cause problems. Gluten, I find, is a huge problem, especially for autoimmune disease. If anyone has an autoimmune disease, I am searching for a gluten sensitivity issue. They may not have celiac, right? They don't have a gluten allergy, but you can have intolerance and sensitivity with gluten. And gluten is in everything. Most people know that it's in bread, wheat, pasta, that sort of thing, but even like different dressings and sauces, gluten is added in. It's just added to so many things because it is a thickener. It thickens things, and in our society nowadays, we're always trying to mass produce, right? So a lot of times it's added and you don't know. So remove things that are triggering. Replace. So replace things like the digestive fire of the gut, and like replace stomach acid. A lot of people are walking around with low stomach acid, and they don't have the typical symptoms of reflux, or they may have been misdiagnosed by having over stomach acid, like overproduction of stomach acid, but it's actually because they have low stomach acid. It feels the same. And so replace low stomach acid if it's present, and we can find these clues to know, hey, there's low stomach acid present by doing a thorough comprehensive history that I do in my clinic, but also by looking at this this type of profile. This is probably someone who has very low stomach acid because they're not being able to kill off some of these bugs. Restore pancreatic enzymes, you know, restore gallbladder function. So that is replacing the digestive fire there. Reinoculate means to give them bacteria that they're missing. You know, I like to put patients on a good probiotic, things that have lactobacillus, bifidobacterium. There is a very specific bacterial species called Akkermansia that is very common nowadays for someone to have a deficiency in Akkermansia. And we can measure this too on this test. And it's so fascinating because this one bacteria, if you have too much of Akkermansia, it has been shown to be linked to things like Parkinson's disease and multiple sclerosis if there's overproduction of it. I think that just speaks to dysbiosis again, right? Inflammation. But also if you have no Akkermansia, if it says on the report Akkermansia and less than DL, that means they couldn't see it at all in the stool sample. Then that has been associated with a lot of metabolic disorders, like having diabetes, having difficulty losing weight, and also having some mood fluctuations too. So reinoculate, put that bacteria back in, they did a study on cancer patients where they looked to see how patients responded to immunotherapy, which is a therapy to get your immune system to work for you to fight cancer cells. They saw that if you didn't have akkermansia, that directly correlated with no effect from the immunotherapy. So you couldn't fight off the cancer cells and you couldn't get improvement with your issue on immunotherapy. But patients who had akkermansia present, then they were able to respond to that immunotherapy and have their cancer get fixed. So that is just so amazing research. And I feel like this is just the surface of it. We are learning so much more about the microbiome, and I'm so happy that it's gotten more press and more attention. But, I'm just hoping to give you guys more information about it specifically and to just really put it on your radar even more. So the next one is restoring that gut lining, like giving it the building blocks that it needs to build up that intestinal lining, right? It's constantly being, broken down and built up. We slough off our mucosa every day too, and that is a very balanced process in itself. What are the building blocks to help build it back up? I use things like glutamine in the practice, things like lysine are also very helpful for building back up these cells. It's really just amino acids, right? Amino acids, which comes from protein, and protein comes from food. But if you don't have a digestive tract that's working, you're not going to break down the protein. You're not going to get the building blocks, and then you can't heal up your gut. So again, looking back at the origins of things. And then the last R in the 5R program is rebalance. And that really is just a reminder to rebalance, the chronic stress, the chronic, the body always being in this sympathetic overdrive, fight or flight mode, rebalancing just how that person lives and trying to work on some lifestyle things to try to help that. So that's kind of usually saved for the end. That's the 5R program. So that's how we help our patients, and and it just really works to help some of these chronic diseases get better. So I wanted to end the talk with how do you prevent leaky gut? And so the first one is to eat whole and real foods. And the reason for that are many. But probably the first reason is, when you eat whole real foods, you are not eating processed things, right? Processed foods have a lot of chemicals in there that can disrupt the intestinal membrane. Processed foods also are void of those building blocks. Usually when things are processed, there's not that much nutrition content in it, so you don't have those amino acids. So not only do you not have building blocks, but you're adding things that are potentially damaging to the gut. So eat whole and real foods, not necessarily whole grain, right? That's different than whole foods, whole real foods. Eat the rainbow. So I mentioned this because, these different colors in our vegetables and fruit, they are information. There's a reason why blueberry looks blue and pomegranate has that beautiful, bright red color. These are phytonutrients and antioxidants and different things in the food. Eat for information, eat your food for information, and in my patients, we go into this deeply to try to talk about different food groups so that they know how certain things can give them things back, like, these phytonutrients and stuff. But eat for information and to try to keep that balance in your gut rainforest. The next thing is to avoid thickeners and gums. And what I mean by that is to avoid these thickeners that they put in food. That can be gluten, but there's a thickener called carrageenan that a lot of times companies add in dairy replacement drinks like almond milk, oat milk, pea milk, that sort of thing, to thicken the drink, right? Because they're trying to produce a lot of it, and it's probably in their best interest not to make it only of almond milk. But that carrageenan has been shown in research to directly cause leaky gut. And the other thing is xanthan gum is another gum thickener they add in those products. So carrageenan and xanthan gum, when you buy products, try to avoid those. Consider avoiding gluten. I've touched on this a few times already, but gluten is a huge trigger for leaky gut. It has directly been shown to cause leaky gut in studies, and that's just kind of all across the board. But some people may not have any issues because they have other things that are protecting their gut, like a healthy gut environment, like they have a lot of good microbes, or they haven't been on antibiotics that much. And so when they eat gluten, they don't feel any different. Fine. I'm not saying everyone needs to go gluten-free, but certainly if you have autoimmune disease or if you have chronic inflammation, really consider cutting out the gluten. And gluten has a half-life, meaning half the gluten still in your body. It has a half-life of 30 days. So one thing of gluten that you eat will stay in your system for 30 days. And so that a lot of people think, well, I'm going to avoid gluten some. It really is an all or nothing thing when it comes to, really trying to be focused on taking it out. The other thing is to rest your gut, to allow repair. We don't want to be eating all the time. We want to rest our digestive system. It's called like breakfast, right? We want to try to like fast overnight of at least 12 to 14 hours. So that our gut can, not be exposed to all this food coming from above, so that it can work on cleaning the house, right? Yeah. The other thing is to avoid acid reducers and acid blockers. I know that this can be really hard to do because acid blockers like Protonix, like omeprazole, Nexium, they are probably either number 1 or number 2 most commonly prescribed medication. And that's probably because gut problems happen so often in our communities, right? But yeah, they're prescribed for things like reflux, for heartburn, for dyspepsia, stress. When you go to the hospital, you're put on a reflux medication, and sometimes your doctor forgets to tell you, hey, let's try to work on getting this off. But it has major consequences because it is working like most medications out there. It's an on or off switch. So what it does, it turns off your body's acid production. And you need that stomach acid to be very robust so it can break things down for you, so it can kill off bacteria. And the GI system is a top-down system. Things at the top need to work in order for the resultant things to work too. So really try to get off those acid reducers. And, at our clinic, we try to help people get off of these very challenging to get off medications. It could take, a couple months to get off, but once you're off, that usually means because we've been able to reestablish a healthy GI tract. So that's great. The next thing is to incorporate probiotics. When you pick a probiotic, try to pick one that's at least like 40 billion colony forming units. A lot of times they sell these probiotics or these probiotic drinks that just have a couple or less than 10 billion CFUs. You want, a good amount there. That's just kind of a drop in the bucket if you're getting less than that. But with probiotics, we want to make sure you're feeding that probiotic to those bacteria, because they're really just kind of like vacationers. You swallow the probiotic, but in order to keep them around, you got to feed it. And then probiotics do a lot of great things, and they make postbiotics for us too. So that's a discussion for another day. The last thing is, I wanted to mention some helpful things in case you're dealing with leaky gut or you suspect you may have it. Try to eat foods with more glutamine, which is an amino acid. It's found in like bone broth, some meats, tofu, that sort of thing. And aloe vera, there's food grade aloe vera out there you can consume, and that can help. But of course, I don't know your case personally, but this is just general things that can help. So please do your own research. And then some supplements with marshmallow root has been shown to really help with leaky gut as well. So yeah, I hope everyone, found some value out of this talk. But really, I really want to stress that if you yourself are having any gut issues, or are dealing with like chronic mood or energy problems, an autoimmune syndrome, or concern that your autoimmune problem is not getting addressed the way it needs to be, to please reach out to our clinic and consider scheduling a consultation with me. You can go on my website and book a free consultation to talk about what issues you're dealing with for us to see if we can help. And most of the time we can do so much to address these problems and to get to the root of things. And so I really urge you to consider doing that, especially if you're dealing with these really, really hard to treat issues. And if you really want to try to prevent this kind of pandemic of chronic disease occurrence. So that is what I have. So,
Wonderful. Thank you, Dr. Den, for giving us all that good information. It's amazing how, when looking at this kind of presentation, how in order to like make sure we optimize our health, our relationship with food almost has to change. It's amazing how things like gluten, the half-life of gluten is 28 days, 20 something days. So if you eat that thing, it really lasts a long time. And if you look up foods that have gluten, you'll be surprised. You'll be very surprised. Things like if I just go to in the categories of candy, things like Crunch, Kit Kats, Butterfingers, like these things have gluten in them, And when you really start to go down this pathway, it's a really deep tunnel. It's a really deep tunnel that you can go crazy on. John, I thought you asked a question about something. You may have deleted the question. Do you want to post that for the group to see? And looks like Brenda, you have a question about seeing patients from another state. We do see a number of patients in different states. I don't know if California is a state that is covered.
yeah.
Dr. Den, can you give us more clarity
so
on
we're able to see patients in multiple states across the US. California is one that I am in the process of being licensed in because we have many interests out there. But certainly if you are interested in seeing me virtually, we can definitely work something out and at least get the introductory, talk with the consultation to see what you're dealing with. But we're almost complete with our licensing over there. So I see that happening in the very near future, that we're going to be able to see patients in California. Other states that we are able to see patients in are in Maine, in Florida, Georgia, of course, and in Colorado. That's the other state. So
yeah. Good news is the licensing it's actually almost insane how the licensing works. It's very easy to get credentialed in a lot of different states. It's almost like a click of a button. John asks a question, and maybe I can just start some of the inquiry on that, Dr. Den. John asks, why do I get tachycardia after eating gluten, high carbohydrate foods? It happens intermittently and did not present until a later age. A pretty loaded question, John, because there's so many factors that kind of go into that. Just as an example, if you don't break down carbohydrates well, within the lab testing, we can see your biochemistry. And if you don't break down carbohydrates well, it can cause all sorts of things. Leaky gut is definitely another thing. If you're at a naturally weakened state, and then you have some sort of stressor, it can cause tachycardia. You can also have issues like having not enough things like sodium, potassium, things of that nature to help carry on reactions. So pretty big question there. Dr. Den, can you add? I'm sure you can give us a lot of different perspectives there, but there's definitely a lot of clarity would need to be had in order to answer that question. A lot of testing would need to be done to fully answer that comprehensively.
Yeah, certainly. I would probably have at least 20 follow-up questions for that specific symptom. But I do hear that it doesn't happen. I don't hear it often, but there has been a few cases where I have heard that. There could be a few things going on. I'll just kind of touch on general things that might be going on. But it might be, as Peter said, leaky gut, your immune system is being triggered by the gluten. And with high carbohydrates, I'm not sure if that includes gluten containing foods in there. But if there is inflammation happening, there's a release of cortisol, right? Which is our stress hormone. And cortisol is excitatory for the heart. And so that could be playing a role. Usually I would see that only if there's already some sort of electrolyte deficiency as well in the setting of inflammation. So it decreases the threshold of being able to kind of irritate the heart and cause palpitations. The other thing is some people might think it's a heart. The etiology might be the heart that's causing the palpitations or the tachycardia, but it could just be a reactive, a histamine release. So histamine is a compound that our body makes and our bacteria make to induce an allergic response. That's why when you take Benadryl, which is an antihistamine, it combats that, right? So histamine can also make you feel the symptoms of tachycardia. And the histamine release could be due to a food allergen that you're eating, like gluten. I don't know if within the high carbohydrate food that you're eating, is there inflammatory oils that's in there? A lot of times people or companies and, these food products that we're eating, they add a lot of omega-6 oils in there, and that can be very inflammatory to the point where you're kind of reacting to it and mounting this histamine release. And that feels like tachycardia, kind of like skipping a beat and that sort of thing in your heart. That could also be present too. And so, I definitely think that should be looked into. And why is it happening later in age? Well, I think that we just have the advantage of youth when we're young and our tissues are just more resilient and that sort of thing. And we feel like we can eat anything and not really have a lot of issues. But as we get older, that GI lining or our immune system getting more irritated and more responsive to certain foods can start to increase. So it's not uncommon too that I see with leaky gut that people start to have allergies. They start getting allergic to everything when they eat shellfish or when they eat gluten or they eat dairy. They start to have all these issues, and it's because of that potentially leakiness of the gut. So there's just this influx of stuff coming in, and the immune system is just so used to being turned on that it's just making histamine, making all these leukotrienes and making inflammation happen. So sorry, long-winded answer to that, but I think that just speaks to so many potential etiologies for why that is happening.
Yeah. And even that answer, John, might be like 10% of the stuff. It could be that, you got to wear a glucose monitor and figure out if you're getting sugar spikes as a result, and the sugar spikes is what you're feeling. And there's a reason behind you have the sugar spikes that might not be as simple as, something related to insulin. So, And again, since the beauty about having a small, intimate group is that we can answer your questions directly. It's rare to have, a doctor that's accessible, that you get to have a conversation with over 10 minutes, So if you guys have any puzzles that you want to solve or try to work on, give us your problems, kind of post it up in the chat, and we'll answer your questions. And so, John, pay attention to how you feel in terms of the dosing of the sugars. You can also pay attention to the oils. The oils is something I know for myself. Later on in life, I didn't realize this, but certain oils, I have a different body reaction to it. Some of them give me palpitations now, and other oils go well with me. And so, very easy to miss, especially when you go to like a restaurant. You don't know what oils that they put in the foods. Not everyone's using, the coconut oils, the olive oils. Dr. Dan, what are some good oils that everyone could stay on, and what are some oils that we can avoid?
Yeah, so I think in our society, we typically have, there's some rare cases that someone is just not getting any oils, and that might be the cause of their problem. So they actually need more omega-3s and omega-6. That's rare though. But how I know that is because we do omega-3 and omega-6, omega-9 and saturated fats testing in our clinic. But most of the population has way too much omega-6, and you need to have a balance of omega-6 oils and omega-3s. So omega-6 oils would be things like vegetable oil, canola oil, grapeseed oil, peanut oil. They call it vegetable oil, but it's not like it's coming from broccoli or something like that. It's more of the seed oil that they're extracting it from. And so a lot of that has omega-6 properties in it, which can be very inflammatory. It secretes things like prostaglandin and that sort of thing. But omega-3 oils would be things like olive oil, avocado oil. So those are the oils that I recommend the most that my patients consume, especially olive oil. And coconut oil is not as much an omega-3 oil, but it can also help with inflammation some. So that might be something that can be helpful. But overall, you want to avoid those other oils. And they really add it in so many different products, like salad dressings is full of soybean oil. Soybean oil is another omega-6 oil. So yeah. And then also, John, I also want to stress, the tachycardia, yes, it's possibly a functional issue, meaning it's not causing life-threatening disease. You're kind of living with it, that sort of thing. But, definitely look into trying to avoid things like gluten and high carbohydrates or different oils and seeing if that helps. But also, we don't want to ignore some potential issues too, right? Like more of like heart issues. So I don't want us to forget that traditional medicine is wonderful and it can be life-saving and detect things that are potentially life-threatening. So if you do have that tachycardia often, it's worthwhile to get an EKG, right? And then to potentially get a scan of your heart to look at the health of your overall heart muscle. But yeah, overall, I usually find that for a young person, and by young, I mean, 50 and less, 55 and less, most of the time it's a functional issue related to food or an electrolyte imbalance or something like that.
All right. Any other questions that any of you may have, anything? I know Dr. Din has been very thorough today. And if you guys maybe right now that you're not having any questions, no problem. Just go ahead and you can email us as well. That can be something that we can do. And also, I'm not sure if there's a link here, but here's also a link for people to schedule with you, Dr. Din, if you have any questions.
Okay. Yeah, here's our clinic website here. I forgot to show that slide.
Oh, perfect. Yeah, it's a very nice website that you designed. Okay. Well, wonderful. Well, thank you for everyone for coming in today. I congratulate all of you for investing time and energy into your health, kind of developing that health IQ. We're going to continue these talks around kind of similar subjects that relate to one another to try to build on your knowledge. Again, our goal is to try to create a community where we all can kind of invest in our health constantly. And of course, Dr. Din is here as kind of like an expert for you. If you guys feel like she could be helpful, just drop her a message. Have a wonderful Saturday. Enjoy the rest of your weekend. It's a beautiful day today in Georgia. Any of you out-of-staters, sounds like California has better weather than us, I imagine. Mm-hmm. Take care and enjoy your families.
Thank you, everyone. See you next time. Bye.
All right. Goodbye.